I'm Dr. Randy Martin. I'm the medical advisor for RunningTrax, and a question that we often get is, should I have a physical exam or an EKG stress test before I begin a training program? And I'll bet you that of the 70 million runners worldwide, very few of them have really had medical clearance, and most of them are going to be okay. But think about these facts. Every year there are about 1.2 million heart attacks in the United States, and a more disturbing fact is that every year there are about 335,000 people who experience what's known as sudden cardiac death. They're at home, they're out exercising, and they suddenly collapse, and if they're not resuscitated, they can die suddenly. Almost all of that, and obviously the heart attacks, is due to narrowing of the coronary arteries, what we call coronary artery disease. Now, the likelihood that any condition will cause an athlete or somebody who's physically active a serious problem is really dependent upon their age. A very young child or a teenager who's playing football, say, or running track, and we read about the tragic occurrence, rarely thankfully, where they suddenly collapse and die, that's due to an inherited abnormality of their heart muscle in this country, something called hypertrophic cardiomyopathy. But when we get into our 30s, 40s, and 50s and we're exercising and start having problems, that's almost always due to the narrowing of the coronary arteries, coronary artery disease. So the answer to that question, should I have a physical exam, really depends upon a couple things, and that's really your risk factors for coronary artery disease. Family history is the most important risk factor. So if you have a loved one, parent, sibling, who's had a heart attack, has had heart surgery, or unfortunately has died suddenly, especially at a young age, you really need to start thinking that you might have inherited a tendency for that. Also, if you've been a smoker, a heavy smoker, or even are smoking now, that's a big risk factor. If you have high blood pressure or on treatment, that's a big risk factor. If your cholesterol, especially your bad cholesterol, the LDL, is elevated, that's a risk factor. And if you're markedly overweight or have diabetes, that's a risk factor. If you have any or all of those, I'd really get medical opinion. One final word is that if you're already running, you've never had clearance, and you start experiencing some symptoms, these are not to be taken lightly. You start experiencing chest pain or it radiates to your jaw, even if it comes and goes when you're running, that's not to be taken lightly. If you experience increasing shortness of breath or even nausea while you're running, not to be taken lightly. And finally, if you have any lightheaded spells or feel like you're going to pass out or actually have a brief pass-out spell, what we call syncope while running, none of those are to be taken lightly. Seek medical help because we as cardiologists can help you tremendously. And finally, I truly believe that everybody should learn hands-only CPR. It can save lives. For RunningTrax, I'm Dr. Randy Martin.